Hi, my name's Lee Plowman and I'm excited to be able to introduce you to Dr Whitney Hauser OD, the founder of dryeyecoach.com. Today I hope that you'll be able to boost your confidence with dry eye and stand on the shoulders of giants. So let's see this great video from Dry Eye Coach which talks a little bit about it, and then we'll be able to chat with Dr Whitney Hauser.
Dry eye, a condition associated with inadequate tear production and marked by redness, itching, and burning of the eye, called also dry eye syndrome, and is a disease that is being treated in 5 million patients, but remains undiagnosed and the cause of great suffering for over 55 million people. The current belief is that dry eye diagnosis and treatment is not profitable because it distracts from profitable areas like contacts, LASIK, and cataracts, requires expensive equipment and non-billable procedures, and is a never-ending battle to treat. When the reality is that treating dry eye increases the long-term success rate of other profitable procedures. It can be diagnosed with standard equipment, and when implemented correctly into your practice, can be a reliable stream of recurring revenue. The truth is that dry eye sufferers will continue to seek care from their doctor or seek another doctor. Dry eye can be a complex condition, but education doesn't have to be. The current resources delve into the physiology, pharmacology, and greater complexities of the disease, but the practical who, what, where, why types of questions remain unanswered. Without a centralized source for this information, patients suffer and doctors are leaving money on the table. Until now. Introducing dryeyecoach.com, the ultimate ocular surface information hub. No need to scour the web picking up bits here and there. We bring all of the best information together in one place. Enjoy short, entertaining, and information-packed videos to help get you up to speed or stay ahead of trends. We even bring in thought leaders for interactive webinars every week. Gone are the days of turning away patients because your practice isn't equipped to handle their care. No more cramming questions and rushing conversations with speakers at crowded conferences. And no more repetitive articles that teach you nothing new. And the best part is that it's all one click away. Our mobile-friendly site is designed to give you quick access to the information you need exactly when you need it. All so you can focus on your practice, give patients the quality care they deserve, and build a long-term foundation for your business. Welcome to dryeyecoach.com.
Thanks everyone for joining us today. Today I'm super excited to talk with Dr Whitney Hauser, OD, about dry eye. Dr Whitney Hauser received her Doctor of Optometry degree in 2001 from Southern College of Optometry. She completed a postgraduate residency in primary care optometry at the Southern College of Optometry. Dr Hauser acted as adjunct faculty member at the Southern College of Optometry from 2008 to 2013. Prior to joining the SCO faculty, Dr Hauser served as clinic director for an ophthalmology referral centre in Memphis, Tennessee. During her 10 years of practice, she not only served the needs of patients, but also acted as research coordinator. Dr Hauser has authored several articles with a focus on the management and treatment of dry eye disease. She's a regular contributor for iTube OD and features on the show She Said, She Said. And she recently appeared on the Defocus Media podcast, and she also featured on the physical therapy podcast Two Nobodies Talking. Dr Hauser has a keen interest in optometry, research, dry eye and entrepreneurship, and she's the founder of dryeyecoach.com. Dr Hauser, thanks so much for joining us today.
Thank you for the invitation, Lee. I really appreciate it.
That's great. We know that dry eye is becoming more prevalent and that it's significantly underdiagnosed. Can you think of one mentor or lecture series or journal article which changed the way that you think about dry eye?
Well, I read so much about dry eye. It seems like it's a constant evolution. There's always something new going on and something new that changes the way you think about it. So, you asked me this question today, and I may answer it one way and I'll answer it a different way, even a week or so later. One of my favorite studies, honestly, was in 2015. It was by Alice Epitropoulos and Cynthia Matosian, and it was about how cataract surgery outcomes can be affected by dry eye disease and can be identified by osmolarity. And I found that really impactful, and not so much for the patients that I see now in my dry eye clinic, but there were questions that I had for years being in an ophthalmology practice where we did cataract surgery and thought, why did this one turn out so much different than planned or different than all the others that we had done? And it really sort of probably answered that question retrospectively for me. So that's probably my most current favorite study, but there's a lot of things, like I said, within the next month or two, it may be something entirely different.
So you completed your residency in primary care optometry, and you're currently seeing dry eye patients full time. So how does
Yes.
dry eye management change the look and feel of your day?
When I was in the ophthalmology practice, I won't say we did exactly primary care eye care because it was a surgical practice, but we did see a lot of different types of disease processes. And, really identifying dry eye in every patient population is what changes my day for me. Because it's so overlooked and underdiagnosed that, being able to just sit down and identify that in a patient's really impactful to their life. Because, they tend to wander through different practices, kind of bouncing from doctor to doctor looking for solutions. And a lot of times, doctors are busy and it doesn't scream their name when they look at it. It's a little bit more hidden. And once we tackle that for patients, their satisfaction is so much higher and their annuity and loyalty to the practice is so much higher. So, just being able to drill down in each individual patient makes a big difference to that patient and again, to their loyalty to your office.
Absolutely, and that might be the key to, like you said before, with the cataracts, having that patient satisfaction go much higher.
Right, right.
You set up the Tierwell Dry Eye Centre from scratch. What was one of the first pieces of equipment for you that made dry eye diagnosis easier?
Well, that's a great question. I was tasked along with my colleague, Dr. Alan Cabot, to start Tierwell, and together we built a practice within a practice, so to speak, within an academic institution at Southern College of Optometry. And we were given a lot of leeway to do so. And, some of that equipment was selected on our behalf or in conjunction with us. And really what we've built since our inception is, a clinic that offers a lot of diagnostic and treatment equipment. So we have a lot of things at our fingertips to help properly diagnose the patients. And that certainly gives us a distinct advantage over most private practices. And really to, pick one thing, that's really, really hard. If I'm going to pick one thing, I'd probably want to have my biography in my office. I do like osmolarity a lot. I like inflammatory a lot. But I do really appreciate my biography. Now, my biography, or visualizing the meibomian glands, could be as simple as transillumination with a light source and looking at the lid margin. You could take it a step further and using something like the Keratograph 5M by Oculus, or using Tear Science's either LipiView or LipiScan to get those crisp, clear, dynamic pictures that you want to see. The advantages that Oculus and Tear Science offer in those pieces is that you can educate your patient about it. Because otherwise, us visualizing it is one thing, and it's certainly important, but the patient being able to see that's really critical to them understanding the disease process.
That's great, and that's a level of understanding that they might not have had before. So let's take a hypothetical patient on those same lines. You maybe through transillumination, you see that they've got a degree of meibomian gland atrophy, but the patient's completely asymptomatic, but they agree to do meibomian gland expression, and you get some thick expressions obtained, and they have a short course of topical steroids, and they come back for a review, and they still say that they're asymptomatic. So
Right.
have we been able to help them?
I think we probably have. I mean, there's dry eye is a chronic progressive condition. Where we would best serve the patient, even above and beyond the expression of the glands by physically taking care of the patient, is the educational component. And that a lot of times somehow doesn't really make a good connection with the patient, between the doctor and the patient. So, if our job is to say, right now I understand you're not feeling this. However, it's just like high blood pressure. Perhaps you don't feel it right now, but going untreated, at a certain point, you're going to be at high risk of stroke and things like that, because a lot of our hypertensive patients really are fairly asymptomatic. So if we can kind of parallel it to a disease process that they already are familiar with, that may help them sort of understand it a little bit better. So if we do our expression, we do our short course, the patient, was asymptomatic to begin with, where the best outcome is for them to continue to be asymptomatic versus become symptomatic after we treat. Then we can say, look, we've done our initial sort of jump start. What can we do to maintain the results that we have? And then we can go with something a little bit more conventional, like warm compresses and so forth. Now, in a very conventional way, warm compresses with warm washcloths and that sort of thing are not my favorite go-to treatment. It's messy. It's not easy for the patient to be compliant. Once they fail to be compliant, they're unhappy to explain to you that they didn't keep up with it. So using something like a brooder mask, something that's going to give a warm, sustained heat, may be more beneficial. So again, the patient education component is really what's key to continuing that relationship and getting that buy-in from the patient. Now, finally, if they're asymptomatic right now and they don't really, buy what you're selling, so to speak, in terms of the dry, progressive nature and so forth, really what you can look at then is you've given them a piece of education they're going to take with them and reinforce that each time they come in, so that when they do ultimately become symptomatic, they're going to know, hey, this is what, Dr. Plowman said is going to happen. I'm going to go back to him and have him evaluate me.
Could you describe it? Would it be almost like going to the dentist to have a clean every 6 or 12 months?
That's a great parallel. The dental model works really well. If we look at a lot of things dentistry has done, they've really done a lot of things the right way. And we really probably as a profession can emulate a lot of their successes. But, particularly with meibomian gland dysfunction is that form of dry eye disease, which makes up about 86% of dry eye in general. That particular type would be served well by a dental model of regular checkups to make sure that everything's going well. And, again, it may be something that takes some time to get our patient base on board with, but I think, the patients that I see, which are the moderate to severe patients, really don't have any trouble latching on to that, and I think it's a great way to go.
Yeah, I'd love to hear about Dry Eye Coach and how does that help? Because we talk to private practitioners. I'd love to find out a bit about Dry Eye Coach and how that helps private practitioners to become more proficient with their dry eye management.
Well, Dry Eye Coach is going to be launching here in the next few months. And, really what it is, it's a website designed to be an educational hub. It's a peer-to-peer sort of discussion, if you will, about dry eye disease. And I've been lucky enough to have some of the greatest minds in dry eye join me. And they're both in optometry and ophthalmology. And they're going to be offering just sort of some clinical pearls that they use. And ways of diagnosing, ways of evaluating, ways of treating the patients that maybe you'd never considered before. And if you really kind of look at dry eye on the internet as an educational opportunity, there aren't that many places that you can go for reliable information. That could be YouTube, but if you go to YouTube, it's about 2 years old is the average video on dry eye disease. If you look through journals and things like that, journals give great information. It's a very reliable source, but it's hard to kind of piece it together sometimes. So what we're trying to do is bring it all into one location. And it's not any one person's idea of what's the right thing to do. We're going to offer a lot of different opinions so that you can be the judge and kind of determine what works for your patient base and your practice.
That's awesome. And with logging into dryeyecoach.com, what's the ideal sort of, would optometrists log in weekly and check out some videos online, that sort of thing?
Even easier than that, if you go to dryeyecoach.com, you can be a subscriber. We'll send out an occasional email blast, probably one a week. We don't want to inundate people's inboxes with things they don't want to read. I get as much of that as anyone and don't want to be that source of information. We'll also queue up in our social media when we have new posts and new videos that get released so that you'll know, okay, I've seen the first, 25 videos. Now there's going to be a whole new set and we'll release them that way too. So a lot of times you don't have to go looking for us. We'll come looking for you.
You promoted Dry Eye Coach on social media and you asked eye docs to register for updates. So what's been the feedback? How has that helped you to get the word out about Dry Eye Coach?
It's been really overwhelming. Every piece of the development of Dry Coach has been overwhelming for me, from the contributors in ophthalmology and optometry, from, the subscribers that we have. We have approximately 400 subscribers to the website that hasn't even opened yet. We have just under 1,000 on Twitter right now at Dry Coach. And it's really, fantastic the way that people have grasped onto what we're doing. And it just really reflects the need that people feel for getting, reliable, cutting edge information about dry eye disease.
Who's been one of the key people in your life that's motivated you to start this passion project?
Well, there have been so many different mentors in my life. One would be Dr. Paul Karpecki. Dr. Karpecki was in dry eye before dry was cool. He's definitely a mentor of mine, and I have the greatest respect for Paul. Dr. Jack Schaefer is definitely someone that has been a great mentor to me. He's, brought me into the lecture circuit with him to be by his side, and that was a great way to, as we say, be baptized by fire. If you can keep up with Dr. Schaefer in a lecture, you're doing well. So it's been a great pleasure to work with both of those gentlemen. And, there's the list is long, I should say, for all of my mentors. And it's probably don't have enough time to discuss them all, but there are so many. And, I feel the same way. I would be happy to help anyone who's interested in dry to just get their feet wet with it. In fact, we've had a lot of people reaching out to us through our social media outlets saying, I'd like to join up, I'd like to be a coach, and we'll probably bring in new contributors and young contributors to the program.
That's awesome. It sounds like there's a great community coming together of people that are all motivated to help.
Right. It really is. It really is remarkable when you think, the world can have a lot of different opinions and a lot of different people that don't get along with each other. In terms of what we're doing, we've had nothing but collaboration, and it's been pretty remarkable.
You've put a lot of time and effort in yourself into this project. How have you found it so far? Has it been it's been challenging, rewarding?
Right.
How have you found it?
Yes, the answer is yes. It's been challenging. It's been rewarding. So I guess that's how you know you're doing something worthwhile, because it's not an easy road. And if someone had told me how much time, energy, and, my own personal, time I would put into this, I probably would have said, maybe this isn't the best idea. However, we've gotten this far. We've had the greatest response that we've had. We just want to keep going, and all of that encouragement really does, keep you on track.
That's awesome. It sounds like there's a great community coming together of people that are all motivated to help.
Right. It really is. It really is remarkable when you think, the world can have a lot of different opinions and a lot of different people that don't get along with each other. In terms of what we're doing, we've had nothing but collaboration, and it's been pretty remarkable.
We'll rejoin Dr. Hauser again soon. How well is your practice website attracting patients? How well does it help them to see who you are and get a glimpse of you and your practice before even stepping foot in there? Grab the free practice website checkup. To get it, just send an email to Leigh, Leigh, at optomly.com.au. It's 100% free, and I'd love to assess your website so that you can get more patients. So send me an email. And now let's head back to Dr. Whitney Hauser. You've put a lot of time and effort in yourself into this project. How have you found it so far? Has it been it's been challenging, rewarding? How have you found it?
Yes, the answer is yes. It's been challenging. It's been rewarding. So I guess that's how you know you're doing something worthwhile, because it's not an easy road. And if someone had told me how much time, energy, and my own personal time I would put into this, I probably would have said, maybe this isn't the best idea. However, we've gotten this far. We've had the greatest response that we've had. We just want to keep going, and all of that encouragement really does, keep you on track.
It's good to have that motivation to keep going, and especially when you're tired, you've had a full week at the clinic, and then you've got to open your laptop up and try and keep working.
I know. When I first started my consulting company a couple of years ago, and I had a new email address, and it was my company's email address. and I would, eagerly open up my email to hope I had an email in there from anyone, even if it was from a clothing store, anything. And now it's like, oh, please make them stop coming. But just like the mail and laundry, the emails don't stop coming. So, but it's a good thing. It's good to be busy. It's good to feel like you have purpose for what you are there to do. So I cannot begrudge my email, but sometimes I want to.
It's always there waiting. But this is it sounds like something that can be a legacy, something that you can contribute.
Yeah, maybe so, maybe so. It really just comes down to the patients and the doctors and bringing the two together with information. So, that's what really fuels me and gets me excited.
Tell me a bit about Dry Eye Coach. Is there a subscription or a cost involved for the service?
There's actually no cost. So we just want to spread information. So it's not a cost at all. And we do look to be worldwide, which you're sort of highlighting today, calling from Australia. But we have subscribers all over the world, and some of our videos will be in foreign languages, or at least foreign to you and I. We'll have some videos that'll be featured in Chinese as well as in Spanish. We want to reach out to as many viewers as we can, or visitors to the site.
That's fantastic. It's a worldwide effort. It's awesome. If you could leave optometrists with one thing to take to their practice on Monday to help their dry eye diagnosis, or just make a difference in their from Monday, what would you say?
Well, just with any diagnosis of any disease, whether it's dry eye or it's a refractive condition or whatever the case may be, the key to everything is listening to the patient. Because the patient, whatever their disease process is, the patient's always telling you the answers. And if you just open your mind and take the time, and sometimes time's at a premium, and I understand that. Because as I mentioned, being at a dry eye center, being affiliated with an academic institution, we have time as a luxury. And having been in private practice when I would see, as many as 30 or 40 patients a day, I get that you don't have that time. But taking a moment and training your technicians to take that same moment. So if you have staff that are working with the patients prior to seeing the doctor, a lot of times staff are hearing the dry complaints even before we do. And getting that information transmitted from the staff to the doctor is really critical. So even just going in Monday morning and saying, hey, all right, we're going to prioritize dry in our practice. And we're going to do it for a lot of reasons. We're going to do it so our patients are happier and stick with us. We're going to do it so they're staying in their contact lenses longer, so we have fewer optical remakes. There's a lot of reasons to tackle it. And if we say to our staff, this is our new priority, and lead the office that way, I think they'll be our greatest advocates, and they'll come in with information that really points us in the right direction to start with. So listening is the key. There's certainly some diagnostic tests you can add on Monday too. I'm a really big fan of lissamine green dye. A lot of us rely so heavily on fluorescein dye to identify things, but a lot of times conjunctival staining is really hard to see with just fluorescein alone. If you put in a little bit of lissamine, give it a minute and take a look, it's much easier to see that conjunctival staining, which can identify your mild to moderate patients perhaps before they have corneal staining with fluorescein. It's funny enough, once you identify that conjunctival staining, you can sometimes see it with fluorescein later.
I like what you said earlier, that getting the team involved, whether that's the team out the front doing reception work or technicians, getting everyone focused or moving together with dry eye. That sounds like a powerful approach.
Right. I mean, if you have reception who answers the call and hears the patient complaint, then they make a note. You have the technician, a lot of our patients will come in and read the acuity chart, and they'll kind of stumble and stammer through the 20/20 line. But if the technician writes down 20/20, the doctor thinks the patient sees 20/20, when in fact, they're really telling us, I have a blurry 20/20. And a lot of times that blur is then resolved by the technician saying, blink your eyes. They blink a few times, refresh that tear film, and they get the rest of the line. Well, again, that's telling us that the patient has dry eye. But we may not get that little nugget of information from our staff. So again, kind of sharing with them, that's how we can kind of move forward. It may help.
We've all had that patient that says the 20/20 line is blurry. So now there's a good
20/20 and 20 happy are so different.
Yeah, Yeah, absolutely. Could you tell us a bit about how we can find out more about Dry Eye Coach and how we can connect with you?
Sure, you can find me on LinkedIn at Whitney Hauser on LinkedIn. You can also find me at my Twitter account is DRW Hauser, Hauser. You can follow Dry Coach at Dry Coach on Twitter. And finally, again, you can subscribe to the website and you can always get emails that you can certainly read or ignore, but they will tell you when we're having new videos launched. And perhaps you go on the first time and you're like, well, none of these speak to me and my practice. Maybe the next round will be what you want to have. You and I have been talking about some practice management things about how you can involve staff with dry eye care. And one of our contributors, I've kind of talked about our ophthalmology and optometry partners in the project, but we also have a specialist in terms of practice management, Fanny O'Connor, who'll be a contributor as well. Fanny's fantastic on Twitter, and you can follow her there. You can find her through me. I'm not exactly sure what her handle is off the top of my head, but she puts out a lot of great information. She'll be contributing. I've already seen some of Fanny's videos, and they're outstanding. So I get excited about her part because her part's the way that we can actually build this as part of a practice and be, a real opportunity for our practices.
Dr. Hauser, thanks so much for joining us, especially on behalf of other optometrists. Thank you for all the labour of love, the effort and the time that you put into this, into Dry Eye Coach, and really appreciate your efforts. Thank you.
Well, I really appreciate it. Thanks for the invitation to speak today, and I hope that we'll get lots of people subscribing, and I really appreciate it.
Thank you again. Today, I hope that you've learned some really useful tips about dry eye and how you can grow your confidence with managing it. Be sure to head to dryeyecoach.com and sign up for the free email newsletter. Also, head to Optomly and grab the free guide, Growing Your Practice with Social Media. Head to optomly.com.au/updates, and both of these links will be under the video. Please also subscribe to this channel, and that way you'll never miss an update. Thanks guys, and look forward to talking to you soon.